Hi everyone and welcome to Anxiety Remedies. Today we're going to be talking about different types of therapy. This mainly comes about because I've started going to therapy now. At the moment, because of COVID, it's on Teams, so it's very Teams based. And for me it's exploratory therapy. Now I've tried CBT therapy, which is probably the one that you've heard a lot about, and this is cognitive behavioural therapy. Now I did get referred to this, so when I went through my the NHS services, I did get referred to a type of CBT therapy which is through the Silver Cloud app. Now some of you may have used this and some of you may not have, but I personally didn't find this app too useful for what I was after. I was after a bit more of a hands-on approach. Cognitive behavioural therapy is mainly a short-term mental health treatment, and this usually looks at your problematic ways of thinking, your really unhelpful thoughts that cause distress, and it replaces them with more useful ways of thinking. With certain cognitive behavioural therapies as well, it mainly focuses around dealing with those emotions and behaviours as they arise and trying to accept and regulate your emotions as that happens. Another way CBT works may be to rationalise things. So when you start to have these irrational thoughts of, oh, this is going to happen, or this is going to happen, or the worst case scenario is going to happen, I'm going to die. And so all of these irrational thoughts and behaviours will get eliminated, because you'll then start to bring your logical way of thinking and actually, be able to rationalise a lot better. And this could be by giving you homework to kind of implement in your everyday life outside of the practice. For me, when I used Silver Cloud and used this app, it didn't particularly work for me, but that doesn't mean it won't work for you. So I tried and looked at different avenues of therapy. There's the Psychodynamic Therapy, which is exploratory therapy, and this mainly looks into the individual's past events and explores what could have caused these ways of thinking now in the present. So it goes back to the origins of your anxiety or depression. It tries to understand your unconscious thoughts, your unconscious emotions, and ties that in with those past events. And this helps to improve your self-awareness and your self-esteem. You start to learn about yourself and about your behaviours and the reasons why you think the way you do and feel the way you do. So for me, that's what I've decided to look at, mainly because of a past event in my life that I think is the root cause of all of my distress and my emotions. And so it's something that I kind of buried and tucked away under the rug. And I think now it's probably time that I start to reopen the box of emotions that I closed all those years ago. So I'll let you know how that goes. I've only had one meeting with my therapist so far, and we gelled quite nicely, and it definitely is something that I think will benefit me. And it might be that I start with this kind of therapy and change to a different type of therapy when I've explored the origins of why I think how I do. Then I might move on to a different type that looks at more of how I feel in the present and how to deal with those things. So just because you think about one therapy to begin with doesn't mean you can't try other therapies that benefit you as well. So we touched a little bit on cognitive behavioural therapy, but there is behavioural therapy in a bit more of a broader sense of the term. So behavioural therapy is a focused therapy, and it looks to change your behaviour patterns or reactions to certain stimuli. So there's different subtypes of behavioural therapy, and the first one is systematic desensitization, and this is where, for example, if you had a phobia, it would expose you to the phobia gradually, which is what I covered a little bit in one of my previous videos. Alternatively, there's flooding, where you thrown in at the deep end and you face your fear dead on. And then you also have aversion, where you associate an uncomfortable thing or feeling or emotion to the behavior that you do want to change. So if you do exhibit those behaviors, you'll then feel that uncomfortable feeling, and that should put you off going back into that pattern of behavior. And lastly, the humanistic approach, and this is mainly looking at trying to reach your maximum potential, living your maximum potential, trying to live up to the best standard, being the best person you could possibly be. It's about increasing your self-acceptance and mainly discussing current events, current issues in your life. Now, this can be client focused, and the client will then lead with exactly what they want to talk about in their lives, what's going on. And it can also cover your existing goals, how you're going to get there, what are you going to do to attain these, and what's stopping you in your life currently. How are you dealing with these issues? Now, a lot of therapists, they do use integrative therapy, and this is, as the name suggests, a mixture of all of the above potentially, and working with you as a person to see what works best for you. It's definitely a daunting thing looking for therapy, especially if you don't really know too much about it or what to expect. I definitely didn't, and I'll keep you in the loop about my journey too. Although I think that going to therapy is definitely a great start for me, but also by doing little things like my yoga, which I haven't forgotten, and I've just had my back, so I've had to have a few days off, but doing these things alongside the affirmations, the pick-me-ups, the meditations, the breathing techniques, and knowing in my mind I've got coping mechanisms if I do start to get myself too anxious and too worked up. It's important that you don't give up on yourself and you don't give up on your mind. See you in the next one.